This is actually a product that we did research on. It's using topical Restylane to treat wrinkles. So you're putting a cream on the face, and the results were amazing.
All right, so right now we have two things that we can use for wrinkles, but we have to inject them. We have Botox, which stops the action of muscle fibers, the contraction of the muscles, which leads to wrinkles, or actually filling wrinkles with hyaluronic acid or other products. And you can actually think of it as putting a little spackle. If this is the wrinkle in your face, and I'm a pretty good spackler there, Jim. And this is what you're doing here. You're actually filling a line with your spackle. But up until now, to fill these lines, we had to use a needle. So they've come up with something. They're doing trials on a product that's going to hopefully get the same result without using a needle.
Well, this is exciting because we actually can use a new system. It's a new delivery system to put the topical into the skin. And the complaint we usually have with products is they don't get into the skin. And this new delivery system gets into the skin. We did a study. We actually compared the cross-linked hyaluronic acid, topical Restylane, with non-cross-linked hyaluronic acid, and then the vehicle. And these are some before and afters. These are 90 days. And we did these study patients before and after. And you can see this is just a topical cream. No needles, no injections, no pain. Put it on at home twice a day. But the most exciting part, at 90 days, we stopped the product. And then we took the patients 30 days out, and we had them come back. And the evaluation of their skin with the cross-linked hyaluronic acid, the topical Restylane that we used in the study, we saw continued improvement. So we had dramatic improvement, smoothing of the skin, texture. It was amazing.
Up till now, people have claimed that they could do this, but the molecules are so large that they just can't penetrate through the skin. And that's really the difference, this system that you've developed that allows things to penetrate that normally cannot pass through the skin.
Exactly. This is nanotechnology. And nanotechnology, this is 1/1,000,000th of a millimeter, so very tiny, smaller than a pore, and so it actually can penetrate into the skin. It's called INpart delivery system. That's what was actually developed by Dr. Modi, and it is the ionic nanoparticle technology.
We're going to show everybody out there exactly how that works. So this is a large particle. What they do, they separate it into small particles and then cover it with a lipid on the outer surface, and that lipid surface is then able to penetrate into the skin, into the dermis, where we want these compounds to work, to form collagen, promote new collagen growth.
I think there are a lot of women who want to know how they can get this.
Yeah, I would love it. I think tons of women. When is it going to be available?
I think we all want it.
Well, hopefully in the next 6 months. There's actually two versions. We have the cross-linked hyaluronic acid, and that's what's been studied, and that's what's pending, and hopefully in the next 6 months. The non-cross-link, which also showed great results, is, I believe we have it for your entire audience, and it is available.
You made some happy people in the audience, men included.
But that's available now.
That's now. That's awesome.
Do I have wrinkles?
I think we should just jumpstart Jim.
Jim,
Yeah.
I have some. You get your first treatment right here.
I think the reason Jim didn't clap
here,
is because he wanted some now.
Yeah.
I don't want to wait.
That is actually topical Restylane from the study. That's actually one of the creams we used in the study with the topical
You're gonna
hyaluronic
trust
acid.
this guy doing this to your face after what he did to your iPhone and your...
Yeah.